The coronavirus pandemic has meant that the NHS has had to divert some of its medical practitioners to deal with the emergency, placing an immense strain on both primary and secondary care. Pharmaceutical company Lilly has accelerated its plans to deliver digital education and tools to help alleviate the strain on diabetes services. It's working with the NHS to create a population health management tool that has the potential to transform the way diabetes care is delivered.
Eli Lilly and Company has been a global leader in diabetes care since 1923. Today, it enjoys a proud history of 144 years, making life better for people with diabetes and for those who care for them. But the COVID crisis has forced a step change in the way companies and healthcare systems operate.
The pandemic has been an unprecedented time for everyone, but what it has allowed us to do is bring our full force as a pharmaceutical company in collaboration with the NHS and HCPs to help those that are living with underlying illnesses, and in this case, it's been diabetes. Full force for Lilly first means our people. We have a team of healthcare workers who volunteered during the height of the pandemic to help the NHS and HCPs first try to triage their cases and patient loads. And then here locally, we've worked and collaborated with HCPs first to listen to what they needed from us and deliver on some educational webinars and joint workings to ensure that they can continue to treat patients who may not have as much access during these times. We know that the cases of diabetes in the UK are on the rise. 9% of the NHS budget is used to treat those living with diabetes. And it's predicted by 2030 that 1 in 4 NHS beds will be occupied by someone with diabetes. We are proud of our partnership with Devon CCG. It allowed us to develop an Excel-based tool that allows Devon to look at their population of those people living with diabetes and the associated risk factors.
NHS Devon CCG in England are already seeing the benefits for their patients and their healthcare professionals.
Well, in Devon, we were lucky enough to be awarded some transformation funding to improve treatment targets for diabetes. We decided to invest in some specialist capacity in the community. We already had some DSNs out there, so we decided to invest in some consultant capacity to work closely alongside GP practices to provide some education and advice on how to manage complex patients so that they could improve their treatment targets. So we needed to come up with a way of dividing it up into different cohorts of patients so that you can spread the workload across GP, practice nurse. It makes it more manageable for them, and having real-time results as well is something that they can, it's more meaningful.
Doing nothing is never an option. The risk is the risk to patients living with diabetes. The risk is the acceleration well before 2030 that more than 1 in 4 beds in the NHS will be occupied by someone living with diabetes. The exciting thing for me is building digital health innovation technology that allows those living with diabetes to be proactive about their health care. We're embracing that change, and it's my hope that the solutions we're building today will deliver better outcomes for those living with diabetes tomorrow. Working for Lilly, leading the diabetes organization, and bringing innovation during times of COVID, it's really personal for me. My mother lives with diabetes. She hasn't been able to see her physician. So understanding the stress, the anxiety that caused her and me as a caregiver to ensure that her diabetes was still very well controlled, it's hard to put in the words. That's why I do what I do. That's why I work with a great team that's able to deliver in times like these.